the monkeypox. In 2019 December, we were thinking that we won't have COVID in India. Later, when I was going back to Kerala, the first COVID case reported in my own district. And we all were in shock because by then people were dying horrifyingly in China. So right now, the condition is this, that it is spreading like anything in Europe. More than 54 countries are affected right now, and it is keep on spreading. And good part is that the mortality is less, but we don't know how the mutation of the virus will go ahead and take its course. So let's move into the basics of monkeypox here. So you can see the picture how it will look like. This is as most of the people who is in this room would have never seen any patient with the smallpox. So this will be little fresh for all of us. So it is a virus infection by monkeypox virus, typically self-limiting, but can lead to severe illness or death. Death occurs up to 11% of cases. So zoonotic transmission, it is primarily found in Africa, around the rainforest. Natural host is unknown. Many species of small rodents, what we also find all around our, this environment is, susceptible to monkeypox virus. So following eradication of smallpox, we don't use the vaccines anymore, so that we all are very high risk for this virus if it comes to in India. So speaking about orthopox virus, we have cowpox virus, variola virus. Variola, we all know it causes smallpox. Monkeypox virus is a species of orthopox virus and poxviridae family. It is a clear zoonosis. It is transmitted to humans from animals, and symptoms are more or less like smallpox, although very less severe. So that's about it. You can see the picture of smallpox there, which we have captured using electron microscope. Now, coming to the division, there are two divisions of it. We call it as clades. One is Central African clade and another one is West African clade, where Central African clade, which began in the country of Congo, is very dangerous. It causes more than 11% of the deaths, whereas in opposite West African case, that is primarily from Nigeria, it causes very less severe infection and very less deaths also in that case. You can see a monkey there, but monkeypox virus, it is like an allegation on monkey. Monkey is not the natural host. Monkey is just like a victim like us. But it has come, we identified it in monkeys, so we call it as monkeypox. So you can see the geographical distribution when we had the infection in 2016, but this has totally changed now. Now it is more in this area. All the European countries, especially UK and Germany, have the largest number. And World Health Network, not World Health Organization, they have already declared this as a pandemic, and in coming days we can expect WHO also take this very seriously and declare as a pandemic. So this is one of the animal you all will be knowing about this. So this can cause this giant poached rats, rope squirrels. I will show you the picture in the coming slides. Infection results from direct contact with the blood, body fluids, or external lesion of an infected person. Eating inadequately cooked meat or infected animals is a possible risk factor, and most of the cases, the source is unknown. You can relate this picture, right? Many animals you would have seen. These all can harbor the virus. Now, how it is transmitted in human to human? It is by close contacts. So one get in family, it is high likely that others may get, and respiratory droplets and skin lesions and contaminated objects can cause this infection. Healthcare workers, once a healthcare worker died when caring for this patient, then the whole attention went to understand that this disease is not something to be neglected. This is very dangerous. This was the history what we had in 1970. Human to human transmission is very limited, but still very dangerous. You can see this small baby, small kid, I would say, with the rashes of this one. Incubation period is 6 to 13 days in most of the cases, but it can go to 5 to 21 days. So we fix it for 5 to 21 days. And the disease course, this after once the symptom starts, the invasion period is 0 to 5 days, which is characterized by high fever, headache, lymphadenopathy, which is a classical symptom of this, which we didn't had in the smallpox. So back pain and myalgia and fatigue, these are the common symptoms. And after that, after these 5 days, the characteristic rash formation will go, and that too in a systematic way it goes. So we can identify this disease clinically by using this movement, this course of these rashes, that is from macules, what is flat lesions, and then to papules, slightly raised lesion, then to vesicle, which contains fluids, and then to pustules, which have pus in it. And later, when it sheds, it becomes crust. And when the crust shuts down, new skin is formed. And once the new skin is formed, this infection is no longer transmissible to another patient. But at the same time, when this affects the various body structure of the human body, it can lead to various complications, and this can lead to the death of the person. And face, it is 95%, and sole and feet of the patient. This is again a classical symptom. No other viral disease, which is relatively, near to this disease doesn't cause this. If the rash is there in hands and sole of the foot, you can identify this may be because of the monkeypox virus. And the most dangerous one is if it affects the conjunctiva. Especially children, this get affected. And when we have this disease in the cornea or in the conjunctiva, the vision gets impaired, and this leads to the blindness. And as this is more in children, and if it is neglected, this disease makes a big, problem to that community entire itself. So it is vital to take care of this. So you can see how, the symptom is shown there in that picture. Now, the differential diagnosis is between three diseases, that is chickenpox, varicella, measles, and smallpox. And we will just see how different these three here we have. Monkeypox fever, we cannot differentiate much, but rash appearance, as I said you, it is macules, papules, vesicles, pustules, and then crust. This will follow a similar pattern. And once the patient is in one form of this rash, the entire body will be having only that kind of rash. Not unlike, chickenpox, where you can find one macule in one part of the body and a papule in other part of the body. This is not going to be like that. Entire body will have one kind of rash, and rash development will be very slow, and rash distribution will be more on the face and on the extremities. And death up to 11%, which is very concerning, and that too with the concoclade. And laboratory diagnosis, we have different stages. We have to go for different diagnostic measures. I'm not going to get into that, but I can say you the confirmatory diagnosis of this disease is using PCR, and other tests, antigen and antibody tests, are not so conclusive. We can say it may be a possibility of any series of this virus, but we cannot say confirmative diagnosis in this way. And as I told you, in incubation period, there is no point in testing. You cannot find out. In the febrile stage, when you have fever, you can take tonsillar and nasopharyngeal swabs, PCR. COVID has taught us lot of us about that, how we have to take that, and all of us in this room have gone through at least one time RT-PCR test. So the procedure is almost same. You have to follow 3 packing system and then to transport at 4 degrees centigrade so that the things will not get disturbed. And in rash stage, you have to go for the symptom lesion sample. You have to take, you have to cut down the rash, and from there the sampling need to be taken, and again you have to follow this three layer package system, and then you have to transport to the laboratory. And in the recovery stage, you can go for serum antibody detection methods, and PCR is the most conclusive this one. And infection prevention control, again we all have gone through many training in this. All thing you have to follow is, first one is standard precaution. You have to wear gloves, you have to wear all the personal protective equipments. Then you have to go for contact precaution. You have to wear a gown so that you will not touch and get the disease. And droplet precaution, you have to maintain a social distancing of minimum 1 meter without doubt. And ensure safe and dignified burial also, because customs and traditions vary everywhere. And how we can reduce the human to human transmission. One vaccine is already approved in 2019. If somebody is already diagnosed with this disease in a family, the other members of that family can be given with that vaccine, but it is not very common like Covaxin or Covishield. But if it comes into that level, maybe some of the big corporate people will take initiative to generate that also. Avoid close contact and use all the infection prevention and control strategies. Now coming to the same only, there is nothing much in this trade. Now, how you will manage the patient? There are no specific drugs available to manage this monkeypox as of now, although clinical trials are undergoing. All you have to do is clear symptomatic management, and the symptoms we all know what is going to happen. You have to manage fever and pain, skin, eye, and mouth care to prevent complication, respiratory care, hydration, nutritional support, mental health support, which we have identified in COVID time. How many people suicide? How many people had the mental breakdown? So we have to take care of this also, because they will be on isolation totally. And infection prevention and control should be followed, whether it is in institution or whether it is in home isolation. So what you will do in fever and pain, the external cooling and antipyretic like paracetamol. And skin care, you have to avoid touching, gentle washing, keep clean and dry, protect hydration. In this case, I missed to tell a symptom that this rash can appear in the mouth also, and in the gastrointestinal tract also, especially in the lower area. So what will happen means the patient, especially the children who will get affected, will not drink any fluid or take any nutrition with this. So because of that, what happens means dehydration and nutritional imbalance results, which aggravates all the complications what is arising out of this disease. So this need to be taken care very importantly, and you have to give saline gargle as much as you can give, maybe 4 times a day, so that the patient feel better about himself to take some fluid. This is about mouth care, what I said right now, and vitamin C can add on, multivitamins also can add on. And eye care, you can see how it looks when it goes for this. And in African case, we have a lot of vitamin A deficiency because of already they are not having enough food to eat. So what will be the case when you had that disease? So vitamin A and its prophylaxis will be added advantage. Respiratory care, this can lead to bronchopneumonia also, which can cause all the problems and respiratory failure, and eventually lead to ventilatory care and death. So you have to take care of this. Rehydration therapy, as I told you, nutrition support also will be very much needed. Mental health and social support, and this you can check in WHO site. What are the specific drugs also you can give? It is already, described by them. I'm not going to read out here, but this is how it moves on. And coming to complication, we have so many complications. As I told you, it can affect eyes, it can goes to lungs, pneumonia, it can cause skin compromise. The discoloration of the skin can come even after recovering from the disease, and sepsis can occur, and that can lead to the death of the patient. So all these things can happen. Now coming to the community part. When you have a disease, how you will go about the surveillance? Because nowadays, as our topic itself suggests, our topic is on One Health approach. One Health approach means it is the association of the medical people along with the veterinary science doctors with the environmentalist, because all the zoonosis disease have this triad running. And when these three type of professionals collaborate to find out the problem and to find the solution, then everything gets solved. If not, it is very difficult. So this is a very evolving concept of One Health for all. So this we need to take up for upcoming other zoonotic disease also. And this is how you have to manage in community. First, you have to report to authorities in whichever level you are, especially for as nurses are now being taken into community health officer positions, you have to report and take it as into more community point of view. Now confirm the outbreak by, getting it tested by PCR test, and convene a multidisciplinary team. Develop a clear case definition about the disease specific to community, and then do the contact tracing to identify all the cases, describe and analyze the data, conduct special studies, and communicate the result to all over the world so that somebody's life in somewhere will be rescued. Now, so almost same only, this is how we have to go about the outbreak response. And about prevention, there are a lot of stigma associated with the disease. Anywhere when this breakout happens, there will be a lot of stigma. You have to break down that stigma and give right information to that community so that you will get better cooperation from that community and it will not spread all over the world. Wear gloves and other protective clothing every time. Avoid close contact. If possible, stay 1 meter distance. And as being nurses more in this group, when you are about to care, do not spend more time with the patient, or try to do the things which you are about to do the patient in a quick span of time, and try to remain 1 meter distance from the patient. This is how you have to do about this. Now, about implication of global preparedness, WHO is doing all the good works, and they are trying to make the vaccine as readily available to all of us. So that's all about the monkeypox. All thing I would like to emphasize here is it can come anytime. It can come. People from UK transport to India. People from Germany comes to India. And if somebody comes here and give us the disease, it can spread like anything. And if it comes and go to any of our animal field, then the risk will be more. Thank you so much.